I'm Dan Duncanson. I'm a board-certified internal medicine physician at SIMEDHealth Primary Care in Gainesville, Florida. Naturally, when one thinks of a discomfort in the chest, they think of the heart. However, there's many other things that can be associated with a discomfort in the chest. The esophagus is a common one. People think of heartburn from esophageal reflux, but the pain and discomfort can be something other than a burning sensation. And esophageal spasm is a cramp of the esophagus that can very much mimic what a heart attack can feel like. The chest is made up of bones and muscles and nerves, and all those can get irritated just like in other areas of the body. So you can have chest wall pain or neuropathic pain associated with discomforts in the chest. Heart symptoms are commonly more than just the discomfort in the chest. The breathing is commonly affected when people are having heart trouble, so shortness of breath or panting. Lightheadedness can happen with heart dysfunction. And then also the discomfort usually radiates to the jaw or to the upper extremity, usually left upper extremity. But also remember the heart is a muscle, and the muscle is going to work harder with activity. So if the symptoms get worse with activity and improve with rest, that could be heart symptoms. Those that get worse with activity, those that cause lightheadedness, especially if you're nearly passing out. If your heart rate starts beating very rapid, or the opposite, beating much slower than what you're used to, and it's associated with any of the heart symptoms, that's a concern. Talk with your primary care physician or nurse practitioner about your heart and your heart healthy status. If we want to do more evaluation, an electrocardiogram is usually done. That's an EKG, where we put small electrodes on the chest wall and on the extremities, and we measure the electrical activity of the heart. The pattern of those activities can give us indications of whether there's anything going on. If we want to look at the structure of the heart, we will do an echocardiogram. That's an ultrasound, and that allows us to see the heart muscle and the valves while the heart's functioning. And then to go deeper into the coronary arteries, the blood supply to the heart muscle, a cardiac catheterization or a stress test is done. Know your numbers, your weight and BMI, your blood pressure, your glucose, your LDL, cholesterol. Those are important numbers to know and work with your primary care physician to get under good control. Exercise is important. Regular aerobic activity of at least 10 minutes each session, and cumulative of at least 150 minutes a week. Keeping your weight under control is important. You can do that through the exercise and eating healthy. Diets with high fruits and vegetable content, leaner proteins, and healthier fats. If you're a smoker, just stop. There's nothing more you can do to improve your heart health than to stop smoking. Rest is important, being able to make sure you get good restorative sleep on a regular basis. And then stress and anxiety increase heart risk over time, so learning relaxation techniques. Most importantly, team up with your primary care physician to develop a strategy for your heart health.